We decided we needed signposting because 60% of our patients who see GPs actually don't need to. They could have been seen by a different clinician, they could have been seen elsewhere, perhaps at a pharmacy, or they could have used a self-referral and managed their care themselves. So we were wanting to make sure that patients get the care that they need, but in the most appropriate way.
Now that I've got children, I find that the triage service is excellent for me to be able to speak to a doctor and get advice over the phone if it's something minor, and also if it's something major, to come in and they will give me an appointment around my schedule. So that's the best thing for me as a parent.
It's impacted other practice systems quite a lot. Mainly the availability of appointments. So because lots of patients are now being signposted, that frees up appointments for patients who actually do need to come in. Signposting initially works when a patient calls or comes in, so the first point of contact for signposting is reception, admin staff. So a patient would perhaps call for an appointment, they wouldn't necessarily know that the best course of action wouldn't be for them to see a GP, so they'd ask for an appointment. Reception would then advise the patient on the best thing to do for the condition that they're coming in for. When we began designing the process for signposting, myself and one of our doctors, we sat down, we had a look at the clinics, telephone calls, face-to-face consultations for the next week or so, and we had a look to see the different things that patients were booked in to come in and see a doctor that perhaps didn't need to, and then we freed that appointment up. We then created flowcharts so that the staff that were using the protocols could easily look and remind themselves of how the protocol worked. And it's really worked well. The admin staff have taken it up, they've really enjoyed it from day one really. They've really been empowered by the new services that they're able to offer patients that in the past they had no idea about. So any practices that are considering, I would definitely recommend it.